Welcome back to Top 5 in 5 from Pharmacy Times. I'm Luke Halpern. Each week, I round up the 5 pieces of content getting the most attention from pharmacists across the country. Articles, videos, podcasts, we cover it all in 5 minutes flat. Here's what was trending this week. Opening up the list at number 5, exciting early-stage research out of the vaccine world. Scientists have discovered a universal nasal spray vaccine showing broad protective potential across multiple respiratory pathogens. The intranasal delivery angle is particularly noteworthy, as mucosal immunity at the point of entry is something researchers have long pursued. A platform that could cover multiple respiratory threats simultaneously would be a significant step forward. For pharmacists on the front lines of immunizations, this is the kind of pipeline development worth tracking, even if real-world research is still a ways off. At number 4, a research-focused piece diving into the molecular mechanisms underlying gestational diabetes, shedding new light on why and how this condition develops at a cellular level. As pharmacists become more involved in women's health and prenatal care, understanding the pathophysiology behind gestational diabetes isn't just academic. It informs counseling conversations, helps pharmacists contextualize treatment decisions, and supports more meaningful collaboration with OB and endocrinology teams. The science is getting more granular, and pharmacists are well served by keeping up with it. Number 3 this week, the CDC has issued a Level 2 global travel advisory for polio, and this piece breaks down exactly what this means for pharmacists in practice. Polio reemerging as a travel health concern is something many in the profession may not have anticipated, but it's a real and present advisory. Pharmacists are often a traveler's first stop before an international trip for vaccines, medications, and general guidance. Knowing the current CDC posture on polio, which populations are most at risk, and what vaccination catch-up looks like is directly actionable knowledge for any pharmacist seeing patients before they head abroad. Coming in at number 2, and this one is a short video, so if you haven't watched it yet, make sure you check it out on pharmacytimes.com. A quick but genuinely useful piece on helping patients understand the difference between clean skin and germ-free skin. It sounds simple, but this distinction gets muddied constantly in patient conversations, especially around hand hygiene, antiseptic use, and skin microbiome health. The video does a great job of giving pharmacists clear, accessible language to reframe these conversations, the kind of practical communication tool that's easy to deploy right away, whether you're at the counter or doing patient education. And the top piece of content this week, landing at number 1, is our podcast covering practical over-the-counter allergy guidance for pharmacists, drawing on global insights to bring actionable tips straight to the pharmacy aisle. Allergy season is in full swing, and this podcast, featuring Derek Webb and Dennis Williams, could not be better timed. It bridges the gap between what's happening in allergy research and treatment globally, and what pharmacists actually need to know when a patient walks up to the counter asking about antihistamines, nasal sprays, and eye drops. If you haven't listened yet, it's well worth your time. A fast, practical listen packed with clinical pearls you can put to use immediately.
I would caution pharmacists. I know it's busy. I know it's hectic. I know things are tough at times depending on where you're working. But I would caution pharmacists to not compromise the integrity of a quality solution for the speed of just trying to get off the floor and back to work. Be careful because you want to ask meaningful questions that can create a meaningful decision or recommendation for this patient. So, I just want to caution pharmacists: don't be so quick with your job that you forget to ask a meaningful question.
Find it on pharmacytimes.com or wherever you get your podcasts. And that's your top 5 in 5 for this week. From nasal spray vaccines to allergy season essentials, there was plenty to keep pharmacists busy. Don't forget, All 5 pieces are available at pharmacytimes.com. We'll be back next week with 5 more minutes of what the pharmacy world is reading, watching, and listening to. Thanks for tuning in. See you then.